Sexual dysfunctions are very common, and most of the time people don't talk about them. But today we want to talk about them. I don't know if you know about sexual dysfunction, but I wanted to share something very important because it is a common thing, but most of the time neglected. But we need to share something on it. Guys, this is Future Talks channel. My name is Vincent, and I welcome you to the channel. Kindly, if you have not subscribed, subscribe, like the video, and share widely. That's the best way you can support us. I appreciate the feedback and also the comments I've gotten from you, and also the DMs I've gotten from most of our viewers. So how we can improve our channel and get it to the better part of it, which everyone gets to enjoy at the end of the day. So guys, sexual dysfunction refers to a wide range of problems that can occur during any phase of sexual response. Like the responses include the arousal stage. First, we have the desire stage, we have the arousal stage, we have the plateau stage, we have the orgasm stage, and we also have what we call resolution. So sexual dysfunction, most of the time it is seen to be affecting men, but I want to tell you that it also affects women. So sexual dysfunction occurs both to men and also to women. So it's a very common thing, and it occurs to both sexes of both gender, of male and female. So like I've said, sexual dysfunction can occur during the sexual response, that is in the arousal stage. The desire first, the desire stage, we have arousal stage, we have plateau stage, and also we also have the orgasm and also the resolution stage. And like I've mentioned, it can occur in both male and female, so it is not only for men. And in this, both men and women can be caused by, it can be either be caused by physical, or it can be psychological, or a combination of both. And we have examples of those sexual dysfunctions. Number one, we have what we call erectile dysfunction, and most of the time it's called ED in the medical perspective of it. So that is where this, and it's very common, erectile dysfunction, where you get that a man doesn't get an erection, and all when that man gets an erection, he finds it difficult to maintain that erection for the time required for some time you get. So if that is the condition of the man, we call that one erectile dysfunction, or ED, when a man has difficulties to maintain, to achieve an erection or maintain an erection during the sexual activity. Number two, we have what you call premature ejaculation, which is also very common, or PE. So that is premature ejaculation, in which a man ejaculates before he or his partner gets ready during the sexual activity. So the man gets easily to ejaculate without in a very short time, like in 1 to 2 seconds. For a short time, you get that man gets that ejaculation, and that is called premature ejaculation. Another form of sexual dysfunction we have, number three, we have delayed ejaculation, which is the condition in which a man has difficulty ejaculating even when he is sexually stimulated. So delayed ejaculation is also a form of sexual dysfunction. So uh, even to the extent that you get that some men don't ejaculate at all, so we call that one delayed ejaculation. Also, we have what you call female sexual dysfunction, or FSD. This is the general term used to describe several types of sexual dysfunctions that that can affect the desire, and also most of the time it's on the women, female part of it, where the ladies do not get that desire and also have difficulty in achieving what we call orgasm in that kind of things in sexual part of it. So you get either in the female sexual dysfunction, a lady may have low sexual desire, or may have also difficulty in achieving the orgasm, and also all have what we call dyspareunia, or painful sexual experience. So that's also a form of sexual dysfunction. So what causes sexual dysfunctions? We have we have several causes of the same of this sexual dysfunction. Number one, we have what you call physical causes, like certain conditions such as diabetes. They can cause sexual dysfunction. Number two, we have heart diseases can also be the main cause of this sexual dysfunction. Also, we have neurological disorders, like the diseases or the disorders which affect the neurological. Neurological means they affect the nervous system of the body, where now you get that person gets into the problem of this sexual dysfunction. We have also hormonal imbalance as some form of physical cause. We also have chronic pain. Can also, if somebody is in a lot of pain, they can't enjoy, or they can develop, or they may be classified to have this kind of dysfunction. Also, we have uh, something like medications, such as those people who use, especially the antipsychotics. Antipsychotics are the drugs which uh, patients who are psychiatric get to use, especially those with anxiety disorders. When they use the antidepressants, it can cause that one. Also, the blood pressure medications, especially the patients who are hypertensive. That's why it's very important for those people who take care of the patient with the high blood pressure to also ask them their sexual performance, and also to get the partners to understand really what is happening about on their sexual performance. Also, we have drugs like antihistamines. They also get to affect the sexual function, and also we have also I say those most of those drugs can bring about sexual dysfunction as a side effect from those kind of medication. So that's the part of the physical causes. Also, we have what we call psychological causes. Psychological causes include the stress, anxiety, depression, relationship problems, past trauma, and also negative thoughts or beliefs about sex, and also body image. When somebody feels that they are not good enough, also it can affect the psychological, they may affect them. Self-esteem also can contribute to sexual dysfunction. So on the psychological causes, we have stress, anything related to stress. We have anxiety, when somebody has a lot of anxiety. When somebody is depressed, that's in depression. Also past trauma, if somebody has had a very bad experience in the past, can also affect the way that person also gets to perform sexually. Also, we have what you call lifestyle factors, like unhealthy habits, like those people who smoke a lot, those people who take a lot of alcohol, that's excessive alcohol consumption, and drug use can also contribute to this kind of sexual dysfunction. Sometimes when somebody takes alcohol, there are people who say it increases their libido and also the sexual performance, but with the time they get to be affected the way it leads to sexual dysfunction. That's why we get to discourage such kind of practices of taking alcohol and also taking of the drugs, hard drugs, which can affect how somebody gets to perform sexually. So we also have what we call age-related changes. So because as people age, they may experience changes in their sexual function due to hormonal changes. Like ladies, they get to menopause, and there's a lot of hormonal changes. The same thing with the men. As they grow old, their testosterone levels go down, or their hormones also get down. So it affects also the performance in the sexual performance in them. Other factors may include things like surgeries, such as prostate or pelvic surgeries, may also can affect sexual function. Also, certain medications also can affect, and especially the patients who undergo things like radiation, it can also affect the way also they get to perform. So, guys, it is very important to understand the underlying condition which is causing such kind of dysfunction. We say something is it something physical? Is it something psychological? Is it something related to surgery? So that the patient gets to understand, or the person gets to understand and get the kind of attention which one wants to get. So when the cause is determined, we have some options of treatment which one gets. So I'm going to mention some common treatment options. Like we have the first part of it, we have medication. So there are several available to treat medications to treat this kind of dysfunctions. For example, we have what we call sildenafil, is the common drug called Viagra. Actually, that drug is used for heart failure problems, but the side effect of it is used as a sexual enhancer. But it's one of the most abused kind of drugs, especially uh, to to get one to get to that level of performance, and when not well prescribed by the doctor, also the physician, one can get himself or herself to death, because it also works in a way in the heart. The organ can get a heart attack and die over the same. So sildenafil is one of the drug used. We have another one called sadalafil or Cialis, which are which is also commonly prescribed for such kind of problems. Also, we have selective serotonin reuptake inhibitors like SSRIs, and we have also topical anesthetics, which can also be used. There are some creams which are applied on the penile part of it to get to work in a way that they can stimulate one to get that good erection. We also have a special way through medication. We have hormonal therapy. We have special drugs also on the hormonal replacement part of it, especially when ladies get to menopause, and if it affects, because not all the ladies are affected with this, they are given hormonal therapy so that they get the body gets to hormonal balance in which it's needed, so that it can cater for the imbalances and also find out and also solve the problem of this kind of dysfunction. That is if it is hormonal related, and we have identified it if it is that one. On psychological causes, like we mentioned, like things like past experiences, some trauma there in the past, and also the issues about the body image. We have what we call CBT, or cognitive behavior therapy, in which the medical psychologist gets to to guide or treat that person through the psychological therapy, through the what we call cognitive behavioral therapy, in which now the person gets some even sex therapy through that psychological kind of counseling and also help. So if the patient has anxiety, because that one can be also one of the causes, it's addressed at that point. And if it's something medical, the patient is gotten into special treatment through that. If the psychologist identifies that problem to be no more of medical, so the patient is put on anti-anxiety, and that problem gets solved. Another aspect of treatment of this sexual dysfunction is what we call lifestyle changes. By making lifestyle changes such as reducing alcohol, drug use, quitting smoking, and improving diet and exercise habits can also improve the sexual function. So things like alcohol and drugs are really the person is counseled to quit them or said to quit them, and also it has shown that with exercise and also and lifestyle such lifestyle changes, they may help that kind of a person become now improve the sexual function of it. Another aspect on the treatment or the management of it, there are special devices which are used like vacuum devices. Nowadays we have even penile implants in which they are put in that penis which has a problem with the erection. If it is now more of the morphology of that penis, so that it gets to the level in which it is wanted to get. So these are the things like vacuum devices and also penile implants. They help to address that sexual dysfunction so that it gets functional. Another level of it, we go to surgery. That's the last result of it. Surgery may be an option even in individual with certain sexual dysfunction, such as what we call peritoneal disease or pelvic floor disorders. Now surgery can be uh, the main approach which can be used to address this sexual dysfunction. On on these managements, like I've mentioned them, they may help the patient, but to some extent, yeah, they may not, even if they are addressed to number one to the last one, it may not solve the problems, especially when it gets into complicated level. Example, if somebody has relationship levels problems, now yeah, you get if somebody is not able to function as this sexual dysfunction, relationship becomes a problem. So because and that person now decreases on the interaction with the other gender, so there is decreased intimacy and communication between partners if they are married people. So relationship problems occur as a complication. Another thing which may occur, we have psychological effects, uh, where one now, if one is not able to perform sexually, that's a complication. They get into low self-esteem, they get into anxiety, and they also go to depression and stress. Especially these things, the psychological effects are more into men, because really, if the man doesn't perform well or doesn't is not able to perform and knows he should perform, so you get that person gets really demoralized, and it can lead to stress and other psychological problems. The person also, another complication which the person gets is decreased quality of life. So that person really feel that he feels very negative about life. So because he feels that there's a part which in the body or in his life or in her life which is not functioning as it should have functioned. Another thing which that person will have is what we call fertility issue. So because some of these erectile dysfunctions can relate to infertility, especially where like the one we mentioned where a man doesn't get to ejaculate, So there is no fertilization which can occur there, and those people will remain infertile in their whole life. So it becomes a problem. And also with sexual dysfunctions, even the ladies get it very difficult to get into pregnant, and this can strain even the family relationship, especially where the people now want to get the kids, especially in an African setting. If people are in marriage, they're expected to have babies, but because of these sexual dysfunctions, you get that there's a problem, and those people can't conceive. They get into marriage for a long time, and because of the very many causes I've mentioned, you get that that person now gets to old age without even the kids, and most of the time there is a lot of straining in the relationship, and most of the people divorce at some point or they separate because now of that they're not able to do that sexual act in the proper way, and also get the kids, and also for the progeny of their generation. There's also increased risk of health problems like sexual things like diabetes and also hormonal imbalances. There's a way sex also helps the body to get rid of some diseases and conditions. That's scientific. So when it is not done in a proper way, and also when there is that aspect of the sexual dysfunction, you get that it's a very big problem to them, and also that one person gets to get exposed to other chronic illnesses, and also if there are chronic illnesses, they get to worsen in the body, because also the sexual activities, there's a way it makes our body produce certain hormones, and also produce special chemicals in the body, which also gets to protect us from diseases. So, sexual dysfunction is one of the most misunderstood topic, or kind of condition, and most of the people get to judge people a lot about it, but it is real, and it is especially in this generation, it is very rampant and very common. But you get that most of the problem, when those problems occur, it's a lady who always gets blamed, especially in Africa, because most of the men don't go for checkups and also find out where the problem is, unless those people are informed, and also they are very enlightened over the same. But you get that these sexual dysfunction problems are most of the time with the men, but they don't go, and most of the time they are solved. They can be solved, especially if they go to the doctor to go and find out where the problem is, and go for tests and find where the problem is, and also go take the treatment as prescribed by the doctor. But most of the men get to ignore that till it is too late. So now, when it's a concern of everybody. So it is very important as men, people go for checkups, especially to check on your fertility, and also it's very important also to discuss with your doctor about your sexual health, because it affects you, and also it affects a lot of people at the end of the day. So sexual functioning is very important, and also sexual dysfunction are very common, and it can get to one or two, anyone, like in every family. You get that there is someone may be affected with this, but people don't get like in Africa, it's a taboo to discuss matter sex especially with the close family. But it's very important, especially I want to talk with men, that you go for a checkup, find out what is happening. And I also advise the ladies, especially when before you get married to someone, or get into intimate with someone, go to your doctor and find. It's very important for men to go for that checkup, and also as couples, go, especially ladies, take your man to the doctor, If you really want to get intimate with that man, find out really what is happening. And some of those disorders, sometimes people are born with them. You get like even the parents know really what is happening with their boy, but they want that boy to get married. Especially in Africa, marrying is a big issue. They want really their boys to get married, even when they know there's a dysfunction somewhere. But the lady gets to suffer a lot, especially if you marry through a wedding. It's really a big issue. The people expect you to have a kid, but you can find that even the parents of the boy knows really there's a problem with their boy, but they don't want to take the medical part of it. They don't want to reveal it to the lady what is happening, what they know about the issue, but they want to try. They want to feel nice that their boy, or their young man is well and is married with a family. But this gets to hurt the lady, and also gets to get into a lot of commotions in the marriage. And also because even in some instances, you find parents know their boy, especially I will come to talk about this one, has what we call undescended testes. This is where the testes of a young boy, or the testes don't get to hang down. They remain in the abdomen when the child is young. So sometimes the parents come to realize too late their boy doesn't have the test, because the tests, if they remain in the abdomen for long, they get digested by the body and they get to be part of the body. And in that instance, you get that boy cannot cannot fertilize or get a lady pregnant or get a baby. So here in Africa, you find the parents know their boy. Maybe they went to a doctor. The doctor explained really what has happened, and maybe said the surgery cannot be done to get the tests back where they're supposed to be. So they get that there's a problem. The doctor explained to them there's a problem in future for the boy to get a baby. But these kind of parents, they organize a big wedding for the boy to get a beautiful lady to come and stay with the guy. And the lady, you find she's very innocent. She doesn't know really what is happening, because most of the people who get married, they don't do a fertility test. And I want to advise really, it is good to do a fertility test before you get into marriage, if getting kids is your thing. Because at the end of the day, if you wanted babies and you get into marriage and there are no babies there, you would really get disappointed. I agree there are people who get into marriage and they don't want to get the kids, but if you are for the kids, there are many options. Yeah, you can stay with that guy, but it's one thing which you should know from the start, and also discuss with your doctor on the options which are there if you really want that kid, and if you don't want, how to maneuver the things over the same, so that you are on the same note over the on before you start that family, and also you expect babies to be there. So babies, or getting pregnant, getting those babies is not about magic. It's about science, and some aspects need to be addressed from the start, so that the one gets into that level where they can give birth. So it is good to be honest from the start. The same thing with when one has hereditary diseases, if there's albinism in the family. This is where we have albino gene in the family. It is good to know, especially before you come together, you be aware that at some point you will get the albino babies in your family. So that you don't get surprised when you get back, and that maybe you've delivered in the hospital, and that midwife brings you a baby who is an albino, and then you start now saying, where did I get this baby, or what really happened over the same. So it is very important that we get to be open, especially as couples. And if someone loves you, you don't need to hide anything from that person. It's good to share the bitter truth about it, and also be ready to face it in future, because at the end of the day, those people who trust us, especially the couples who come together. They want to know really about ourselves, and also at the end of the day we'll get to know about what is happening. And it really hurts when we don't know everything about them, especially regarding their gene combination and also their physical body. We come to discover later that they knew something wrong went somewhere in the past, and also so that we get a lot of disappointments at the end of the day, which can lead one even at that point commit suicide, because somebody feels betrayed, and also goes into depression and other problems, which could have been prevented if we became really open and also shared over the same. So it's very important we get to know each other very well. And also in this sexual dysfunction, it's not a one-man show, it's both sides. You may be right, yeah, the lady may be okay, but the man has issues. So let the other party be very supportive, especially on the psychological part of it, and understand what is really going on. We found out diseases like diabetes and also hypertension can also bring problems of the sexual functionality. So it's very important to understand your partner very well and understand the condition, and also ensure that the person is in the right management, so that we prevent those dysfunctions at all costs in our lives, because they are preventable. And when managed well, everything get into functioning very well. Yes, we know sex is not very important, but it's very important in every aspect of life. Let nobody cheat you that sex is not important. It's very important to a 99-year-old, like to an 18-year-old, like to a 30-year-old, and other aspects of it. So let us not live in ignorance, but appreciate that this sexual dysfunction are there, and there are options out there to manage them very well. Welcome, guys. Love you very much, and also I want to welcome you to our next video. Welcome, guys, and peace.